going to be demonstrating droplet precautions, which are the current level recommendations for COVID-19. Just so we're clear, when we're talking about droplet precautions, we're not talking about aerosol generating procedures such as intubation, chest compression, non-invasive ventilation. This is what we're doing about 90% of the time right now with these COVID patients. So when we're going to start off, we've actually put signs on the rooms outside, and you'll be seeing more of these. First step, as always, will be hand hygiene. You're noticing I'm wearing a ring here. I'm doing this intentionally to remind us that we should not really be having watches or any jewelry on us, so please go ahead and remove your jewelry. First step is going to be hand hygiene before we do any of this. Here I'm using hand sanitizer, and to remind you of hand washing technique. Start with the palms, go to the back, interlacing our fingers, the other hand to the back, interlacing fingers, squeeze fingers together to get the grime in between. Remember the fingertips on one side, fingertips on the other side. Get our thumbs, both sides, and then finally our wrists. I'm going to start off with a outer glove. We're here using a double glove for the sake of healthcare worker protection. And notice that my next step is going to be my gown. I'm using the blue gown here. A lot of facilities use a yellow gown. It's not really much of a difference into which gown you use, except to remember that your gown typically should be long enough to cover your hand all the way down to your wrist. Just be sure to try and secure the gown at the back so we don't accidentally make contact in the patient area. Once I put on my gown, I'll now be putting on the important aspect of my droplet precaution, my face mask, as well as my eye protection. And I'm going to be using a surgical face mask. You don't need to use an N95 or air-powered respirator, unless, again, we're doing airborne precautions in the room, which would be if we did some sort of aerosol generating procedure. I'm now going to go ahead with the last step of this, which is putting on my outer glove. Typically, when I do an inner and an outer glove, my outer glove is usually a little bit larger than my inner glove. And now that I have my outer glove, I'll be going to proceed into the patient's room. Once we're inside the patient's room, we are now technically in a contaminated environment. The most contaminated part of this uniform, in general, of this PPE, are my gloves, because this is where the part of my body I'm using the most. And the reason we say this and remind you is because the very first step in doffing has to do with hand hygiene first. On the inside of each room, you should now start getting used to seeing a checklist to remind us how to go about doffing. And you'll notice that hand hygiene is the very first step. In this room, I'm going to be simulating a hand sanitizer over here. I actually don't want to go ahead and use these Santa Claus right now because we are in a critical shortage of many of these supplies. I would be doing hand hygiene in exactly the same way I demonstrated earlier. Once I've done my hand hygiene, you'll notice the next step on my instruction sheet advises me to remove my outer gown, then my gloves. Now, I have the option of removing both of these together so long as my gown and my glove are covered. If I have a gown that's too short and my wrists are exposed, it's probably safest and best to remove just the gloves first, then the gown, and making sure you're doing hand hygiene in between. The key aspect of doffing is every single time I touch my PPE, I have to think of my hands as contaminated and therefore perform hand hygiene at every step in between. So the first step was hand hygiene. I did that. I'm now going to remove my gown. The safest way of doing this is reaching around my waist, pulling so that my waist ties are undone. I want to go ahead and do the same thing around my neck. I'm going to let some of this come down to my forearms. And as I'm doing this, I'm rolling out my gown away from me in a circular motion so that the only part that is in contact with my skin is the inner, cleaner portion. I have the option to remove my outer gloves. I'm going to do so, as you can see here, by grasping on the inside and doing the same on the other side. We should be maintaining 6 feet minimum distance from the patient so that we are not technically at risk of being contaminated again. Go ahead and perform hand hygiene one more time. Because I made contact with PPE, and now that I have performed hand hygiene, I'm now going to go ahead and remove my inner glove. Remember, we're trying to remove as many contaminated items while we're within the patient's room because I do not have an ante-room in this situation. To remove my gloves, we can do either the glove and glove method or the beak method, where I take my finger, pinch my wrist, form a tent, form a beak with my fingers. Once I've formed that beak, I'll reach the opposite side wrist, slide that off, gently to the bin. I'm now taking my index finger, making contact only to a clean inner portion, and now disposing off that glove. Once I've done that, for the sake of my safety again, I perform hand hygiene in the usual fashion as described previously. Once I've done that, now it's time for me to exit the room. I would like to preserve my face mask and my eyeglasses and maintain droplet precautions while I'm in the room until I get outside. So these will stay on. I'll now exit the room, ensure that the door actually closes behind me. I'm going to perform hand hygiene one last time. As described previously, I have 2 options at this stage. I can remove my eyeglasses and my face mask and dispose of them. Now that I am no longer in a contaminated zone, this is the time for my droplet precautions to come off completely. However, given our current situation in which we're facing severe restriction in supply, I actually have the option of keeping both of these on and going on to evaluate multiple patients in a serial fashion without taking them off, so long as I do not touch them or contaminate them. If I'm to take these off for the sake of having some food or some drink, at that point I do need to dispose this off. And if my eyeglasses are not disposable, I need to now wipe them clean and disinfect and decontaminate them before they come back on again. So if I'm going to go ahead and take off my face mask and my glasses, I've got to make sure that once I've left the room, I perform hand hygiene. Once I perform my hand hygiene, I'm now going to go ahead and take off my mask. Remember, what's really important about this mask is that I don't make contact with the mask or its sides, but I go ahead, reach behind my ears, reach for where the loops are, slowly remove them without flicking the mask, and gently bring them down. I'm then going to go ahead and do the same thing with my glasses, making sure not to touch my skin. I'll go ahead and touch the rim of my glasses, take them off, and then the most important part of this is now I've made contact with potentially contaminated PPE. I need to perform hand hygiene one more time.